Good evening, friends. Welcome back, team. It is Tuesday, June 23rd, 2026, and a massive wave of medical news just broke across the globe. From major regulatory overhauls in hospitals to breakthrough studies that challenge everything we know about aging and clinical therapy, we have a lot to unpack today. If you want to stay ahead of the health curve, hit that subscribe button right now. Let's jump straight into our top headlines. Segment 1, the Global Medical Education Shakedown. Our first big story comes out of India, and it is sending shockwaves through the medical education community. The National Medical Commission, NMC, has officially drawn the curtain on all postgraduate diploma medical courses nationwide. Starting with the upcoming 2026 to 2027 academic year, admissions to these two-year specialist diplomas will happen for the very last time. After that, they are completely banned. Now, why is this happening? The NMC is shifting the entire medical education system toward a uniform framework of full MD, Doctor of Medicine, and MS, Master of Surgery, degrees. Medical colleges are being allowed to convert their existing diploma seats into full degree seats. According to officials, these diplomas have simply outlived their purpose. Over 3,300 seats across critical specialties like anesthesiology, pediatrics, OB/GYN, and radiodiagnosis will now be absorbed into standardized residency programs. This comes right on the heels of the massive NTEG 2026 re-examination that took place just 48 hours ago on June 21st, where over 2 million students had to retake their entry exams under airport-style security following a massive paper leak scandal. The medical field is tightening its standards globally, and this is just the beginning. Segment 2, Clinical Breakthroughs, Rethinking Cancer and Alzheimer's. Next up, let's talk about the incredible clinical research hitting the journals today. First, a shocking discovery in cancer treatment. We are seeing major updates regarding CAR T-cell therapy. Scientists have successfully boosted the success rate of this groundbreaking immunotherapy for blood cancer simply by blocking a specific, newly identified protein. By turning off the single protein molecular switch, they prevent the T-cells from getting exhausted, allowing them to aggressively destroy cancer cells for much longer periods. Meanwhile, in brain health, a massive 50-year review just dropped regarding Ebola virus transmission. Despite ongoing fears surrounding the May 2026 Bundibugyo strain outbreak in the Democratic Republic of Congo, data tracking cases from 1976 all the way to May 2026 reveals that global spread remains remarkably rare. Only 28 cases have ever been recorded outside Africa in 5 decades. Health officials are using this to reassure the public that swift local source control is our strongest weapon, and a global pandemic from this outbreak is highly unlikely. And for those tracking mental health and wellness, a new study from UMass Chan shows that specific biomarkers in brain activity can now actively predict if an individual is vulnerable to a relapse in alcohol use disorder. This opens the door for hyper-personalized, preventative neurological care before a relapse even happens. Segment 3, The Longevity Revolution, Challenging the Aging Myth. If you think growing older means a guaranteed, non-stop physical and mental decline, a brand new long-term study out of Yale University is here to tell you that you are dead wrong. Researchers tracked older adults and discovered that nearly half of adults over the age of 65 actually improve physically, mentally, or both over time. The study proves that our brains and bodies maintain hidden regenerative and adaptive powers well into our 80s and 90s, provided they are stimulated correctly. Speaking of aging well, scientists looking into genetic anomalies have isolated a rare genetic variant in exceptionally long-lived families. This specific mutation acts like a natural thermostat for inflammation. It keeps systemic inflammation perfectly tempered, which drastically delays the onset of chronic age-related diseases. Combine that with a fascinating food science discovery published this week, scientists have identified what they call nutritional dark matter. Turns out, thousands of complex chemicals in our daily food go completely unlisted on basic nutrition labels. Mapping out this chemical dark matter is the new frontier for understanding why certain diets rewrite our microbiomes and prevent diabetes and heart disease. Segment 4, FDA Policy and Biotech Approvals. Next, let's talk policy and Big Pharma, because what happens in the regulatory rooms impacts your wallet and your medicine cabinet. The medical community is closely evaluating the FDA's freshly issued 2026 guidance on consumer wearables and wellness devices. As smartwatches and biosensors get more advanced, the line between a casual fitness tracker and a regulated medical tool has completely blurred. The new FDA guidelines force a strict validation standard on these tech companies. If a consumer wearable claims to detect irregular heart rhythms or track physiological distress, it now has to undergo rigorous clinical retesting. Expect a massive shift in how Apple, Samsung, and our market their devices moving forward. On the pharmaceutical front, AbbVie has just secured official European Commission approval for its drug risankizumab. This approval specifically targets pediatric patients suffering from moderate to severe plaque psoriasis, giving families a powerful new biological therapeutic option to manage chronic, severe skin inflammation. Risk for suicide. A potentially fatal symptom of anxiety and depression is feeling suicidal. The risk of suicide is different if you have anxiety, depression, or both. In one study, those with anxiety were found to have twice the risk of suicide compared to those without anxiety or depression. Asterisk people with depression were 26 times more at risk. Those with both anxiety and depression were found to be 54 times more likely to end their life by suicide asterisk than someone without either illness. WebMD. Subjective age, how old a person feels rather than how old they are, may offer clues to sleep health and daytime functioning. In a cross-sectional survey, adults who reported feeling older than their chronological age consistently reported more insomnia symptoms, less regular sleep, and greater daytime impairment, even after accounting for chronological age, sex, race, depression, and anxiety. Medscape. You don't have a social network. Staying connected with friends and family can help you stay young at heart, and boost your emotional and physical health, too. It helps stave off anxiety, depression, and the dementia linked to old age, including Alzheimer's disease. And when you look for a community, remember, it's the quality of your social connections that matter, not the quantity. WebMD. Outro. There you have it, your daily medical news briefing for June 23, 2026. From the death of medical diplomas to the rewriting of human longevity rules, science is moving faster than ever. I want to hear from you down in the comments. Do you think the FDA is right to strictly regulate wellness smartwatches as medical tools? And what do you think about the NMC shifting entirely to MD and MS programs? Drop your thoughts below, smash the like button if you found this video valuable, and I will see you in the next one. Stay healthy, stay informed. Disclaimer, compiled information. This content is for educational purposes and is not a substitute for professional medical advice. The audience must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.